Hello, and welcome to Resilience Radio. I'm your host, Irvin Eisenberg, also owner of Resilience Occupational Therapy. As always, the opinions on this show are never meant to be diagnostic or giving medical advice. Everyone's got their own unique needs, and you should seek healthcare practitioners as appropriate. Additionally, any opinions are just conversations I'm having with people. Don't necessarily reflect opinions of me or Resilience Occupational Therapy. Today on the show, I've got Rich Marantz, I hope I pronounced your name right there, who does a number of things, including being a holistic nurse and a Tai Chi instructor. It's great to have you on.
Thanks so much for having me here. I'm excited to have a conversation with you.
Now, you're in Vermont, right?
That's correct. Yep. Yes.
What part of Vermont are you?
So I live in a little town called West Paulet, Vermont. It's in the southwest corner of the state, and the biggest town that's near us is Rutland, about 45 minutes from me, and that's where I work for a hospital in Rutland. So,
okay. And then your Tai Chi school, where is that?
So I base it out of where I live. Right now I'm teaching classes at a place called Stone Bowl Farm. It's like a retreat center about a mile from me. So I teach my classes there, and then I do private instruction. I rent a space in Dorset, Vermont, about 20 minutes from me, from an acupuncturist, and I do either acupressure treatments there or private instruction there.
Okay. So it seems like you've got a lot of things that you have weaved together here. Which came first? Walk me through your path a little bit.
As far as between like my nursing and everything else, you mean, and the Tai Chi?
Yeah, the nursing, the Tai Chi, and the other alternative Chinese medicine stuff.
Yeah. No, that's a great question. So I kind of took a route that's different than most people in Western healthcare. I actually started with Tai Chi and Qigong. I was disabled with a spinal injury. So I was in my 20s and just lived in terrible pain and couldn't do anything, couldn't work. And I went to acupuncture. So this was 36 years ago, and went to acupuncture, and it actually helped because Western medicine wasn't helping with my pain. And I went and read in the library about Chinese medicine because I wanted to know more, and I saw about Tai Chi, and I'm like, oh, that's pretty cool. And the fact that it was a martial art, because I grew up wrestling and doing some fighting arts, and so I was always interested in the martial arts. And back then I was kind of a self-proclaimed tough guy, wasn't really, but that was a self-proclaimed thing when I was in my 20s. So I found a Tai Chi teacher and started with that, and just kept going and going and going, and studying more with martial arts and more with healing arts and with some different teachers. And it wasn't until, I was 51. I had never been to college before. I was a craftsman when I was younger, learned like through apprenticeships, and decided to go to college. And I thought, I want to do something that helps me deepen my understanding of the human condition and to be able to make a living at the same time. And I landed in nursing. And so I decided at 51 to go to college. And, between when I started Tai Chi and when I went to college at 51, I did a lot of studying with different, Chinese teachers and other teachers to learn Chinese healing, martial arts, Tai Chi, Qigong, meditation. And so I landed in nursing. I went to college and I got my degree in nursing and started working at that, and then continued on. After I got my bachelor's, I decided to, instead of going for my master's, I took a year-long integrative healing arts program, which led to my certification as a holistic nurse. So, I see a lot of people in Western healthcare, working in Western healthcare since they're young, and then start finding that these integrative therapies are really useful, whether it's for themselves or for their patients. So they start going at it from that perspective. So I kind of did it opposite of what most people, I think, that I see do.
Can you describe a little more what holistic nurse, how is that different than what people might just think of as standard RN nursing?
Yeah. So the idea with holistic nursing is it's basically wherever you work, in whatever unit you work on, whatever type of nursing you're doing, you can be doing holistic nursing. The basic premise, some of the basic premises of holistic nursing is one, paramount is the idea of presence. To truly be present with the patient you're with. So instead of seeing them as a task to do, although nursing's filled with tasks, right? We have numerous tasks that need to be done, but we don't ever forget the human aspect of it, the person that's sitting in front of us. So we go into every situation with true presence to truly be there for that patient and with that patient. Right? We're going it through whatever we're going through with them as opposed to doing something to them or seeing them as a barrier to getting our job done for the day. And then the other aspect is that in Western medicine, and I'm not against Western medicine. I'd be a fool if I was in nursing if I was. There's tremendous value to Western medicine, right? However, it becomes very reductionistic. So we see the body as parts in Western, right? And everybody's specialized. And if you're not dealing with this part, well, I don't want to hear about that part of you. I only want to know about what this, your heart is doing, your kidneys are doing, or what your knee is doing. I don't need to know the rest of that. Whereas in holistic nursing, we approach it in the way that whatever concerns that person concerns us. That every aspect of them as a human being affects the issue that they're having. And I learned that firsthand when I was a visiting hospice nurse for a number of years. And I really got a chance to put that into play. So I would often say to the patients when I first met them, whatever concerns you concerns me. So when I would go into their house, I would listen to the thing that's first and foremost on their mind, whether it had anything to do with the tasks that I needed to accomplish. So in holistic nursing, it's right in the name. We see people as a whole being, everything about them, their relationships, their spiritual practice, their emotional health, their mental health, their physical health, their lifestyle, their environment, all of these things come into play. So we're looking at all of that when we're looking at a person, as opposed to just seeing that single aspect, that single symptom.
So so it sounds like holistic nursing is a mindset more than a specialty or it's the lack of specialty in the sense of you're trying to look at what's going on with that person and taking all the factors they have into account.
Yes. And it is a recognized, I'm board certified, and it is a recognized specialty within the American Nurse Association. So it is seen as a specialty, but the thing is it works whatever specialty you're working in, right? No matter what environment you're working, you could apply the principles and the ideas and the concepts of holistic nursing into whatever you're doing, and then we also we are trained in and learn integrative health practices, anything from aromatherapy through sound, through, massage, through, I do acupressure, through all these different modalities, through music, that we learn how to use integrative therapies within our scope of practice, in addition to, say, in my case, doing an EKG on someone.
So I've been trying to think how to structure this particular interview, and I'm thinking that I want to we'll dig more into the nursing and how you incorporate the alternative work that you already have. And then I want to afterwards, we'll have another episode people can stay tuned for, where we'll discuss some of the more nuances of Tai Chi and Qigong work and such. But feel free to discuss any of that now as well. But I was thinking about, well, for one, I'm curious, you're a holistic nurse. What setting do you actually work in right now?
So currently, I work in a outpatient cardiology clinic. So I've been there for about a year and a half, and I do anything from phone triage. So I have to assess people over the phone when they call with issues, which, really usually we assess people face to face. So being able to assess people just by their voice and sometimes talking them down off a ledge, because they're very upset because they're, in a bad place. So it's just a lot of critical thinking all day. So, I have to really apply the compassion for the person on the other end of the phone, especially when they're yelling at you, right? We get that. And so learning how to deal with people in a compassionate way and seeing again what's really the issue going on beyond their symptoms that we can help them with. And then I also work in cardiac rehab where people who've had heart events, they come in and do exercise and we monitor them while they're doing their exercise. And again, I get a chance to deal with them in a way where they bring up things and I say, okay, well, you can look at this, maybe a sleep pattern or whatever it may be, or nutrition we can talk about in addition to exercise. So I'm able to bring the holistic nursing into that. But it all comes down to really being very present for the people and making
Mhm,
it about them and not me.
mhm.
And then I also do inpatient nurse assess or in-person nurse assessments. People come in with symptoms or checks. They can't get in to see the cardiologist. So I'll do an assessment on them, a face-to-face. So those are kind of the three aspects of my job currently in cardiology. And it's quite interesting. And I like dealing with the patients a lot.
So, and because this is going out in Vermont, if there's things that you don't feel appropriate to say with your work, I completely understand that. But it seems like you've got this scope of practice, which sounds familiar to me. In some ways, it sounds like there's a lot of overlaps with occupational therapy,
Right.
meaningful activity, and then person-centered therapy. It's not obviously unique to any given thing to actually try to care about your patients as a whole being first. There's Within the medical system, there's the clear hierarchy, and nurses, with the exception of nurse practitioners and certain settings, almost always are working under the license of the doctor or in relation to the doctor. And then you've got this fairly holistic scope of practice, and you've got the practices of whatever institution you're in. Where where do you feel like you bump up against either what's of something that you feel like you might be able to offer to help someone with, but is not appropriate for your setting or the particular your scope or your setting or the particular hierarchy that you're dealing with?
Yeah, it's a fine line. And it's at the beginning when I started when I was in hospice. So I came into cardiology outpatient clinic after working in hospice in people's homes, which had an immense amount of autonomy, right? There was so much autonomy with that. And it was truly
Hmm.
holistic. I mean, it was really holistic work. So I had a lot more freedom with that. And then when I came into a clinic where there are cardiologists and nurse practitioners, yeah, I have to defer to them and I have to be very careful to not go out of my scope of practice and also not go out of what they think is appropriate, right? So the people I work for, the cardiologist, the nurse practitioner, they're aware of my holistic nursing, and I will put it in my clinical notes if I do something that is an integrative therapy. And I'm very mindful of staying within my scope of practice, because like it or not, when you're a nurse, probably the same as an occupational therapist. The first idea is, am I doing best for my patient? The next is, am I going to keep my license?
Hmm.
Am I going to put my license in jeopardy? Right. So we keep that in mind. So, and I don't think that's necessarily a bad thing because it keeps us from going out of our scope of practice. It keeps us from experimenting with somebody, right? We stay with what we're competent with and what we've been trained in and what we are allowed to do underneath our license. So, but if I ever have a question about it, I check, right? I check with somebody. I'm very mindful about that line of doing enough for the patients without going out of my scope of practice or doing something I feel that the cardiologist wouldn't feel really has good scientific evidence base with it. So I check with them, right? I talk with them and see, let them know that's what I did. And like I said, I put it in my clinical notes for them to see. But it's something I am very mindful of. I don't take that lightly.
So you have this Tai Chi and acupressure, meditation, and Qigong background that predates your nursing. In what ways are you or I assume that the holistic nursing included more than just those things, because that's stuff you had in advance prior. How much are you drawing from those specific things versus other types of modalities and practices that you learned? What do you feel like you're drawing most heavily from?
I think, well, currently, well, when I was in hospice, well, so prior to hospice, I worked on an inpatient psychiatric unit.
Hmm.
So in there, I used a lot of breathing with body movement. So like really simple Tai Chi movements, like preparation movement or wave hands like clouds to bring down anxiety levels, to calm people down. Very, very effective. And I wasn't obviously allowed to touch psychiatric patients, inpatient psychiatric patients, but I would do a lot of breathing and movement with them. And it inevitably was really very effective. And the whole milieu would just calm down. Both the other patients and the staff would talk about, say, wow, it's just very common here, which is one of the goals on an inpatient psychiatric unit.
That's great.
In hospice, I did draw a lot upon, I did a lot, within my understanding, I did a lot with aromatherapy with my
Hmm.
patients. Within my understanding, I just have a working knowledge of it. I'm not like certified in it or anything, but I have a working knowledge of it and some training in it. I did acupressure on my hospice patients with really good effect. And I would teach a lot of kind of like lifestyle type things and philosophical ways of looking at things to help people come to terms with the fact that they were dying. So I did that. I consider holistic nursing. We talked a lot, we dealt with a lot with the spiritual aspect of things. In my setting now in cardiology, it's much less bringing the integrative therapies into things. I do sometimes talk about if people are not having good success with sleep, I teach about sleep hygiene and some of the integrative therapies that go with that, like music and aromatherapy and stuff.
Hmm.
And periodically, I will show a patient a point to do on themselves for acupressure.
Hmm.
And I will teach people some breathing techniques to help relieve symptoms and to help calm down and lower anxiety levels. So I will teach people some breathing exercises. In the setting I'm in now, I don't get as much opportunity to bring integrative therapies in. So I really just kind of deal more holistically with them just through presence and listening and just giving those type of suggestions, lifestyle suggestions, and things like that.
So I see in your description of having practiced the Tai Chi and a lot of the integrated therapies and fairly deep practice prior to becoming a nurse tracks a similar trajectory as my own. I've had some of the alternative, less mainstream at least, approaches, the structural integration and the massage, some hydrotherapy stuff, and then I'm familiar with from my massage school training some acupressure and other things. And then I went to occupational therapy school where they're not teaching us any manual skills beyond some basic manual muscle testing, but I draw on those things. And I see people um, taking a weekend course or a week course in dry needling, more PTs than OTs doing that, or in chair Tai Chi or chair yoga, and these things where I think it's great that these other interventions are being brought in, but it feels modular and I question even whether the therapists in those cases, and this is different, a little different than nursing, are really staying within their scope or respecting the deep practice that somebody might have in yoga. To me, it feels like I don't study yoga. I've taken some yoga classes. I'm not an instructor in it. That if I were to do yoga and present myself as here, I'm really doing yoga for my clients, that would be, I'm able to bill insurance companies. The yoga instructor is not. There's something disrespectful to the profession of yoga and the practice of yoga in that. And I'm curious what thoughts you have on that, because it seems like you're coming from a similar background in that respect.
Yeah, there's a lot I think there is a lot to be said about that. And as my one teacher said, flip the coin at all times. So there's two sides to this, right?
Mhm.
More than two sides, maybe. So I think initially the idea is you bring up, say, yoga. I'm not a yoga practitioner. I practice Dao Yin, which is basically like Taoist yoga, right? We could, just for the simple sake of it, we could say it's Taoist yoga. But I would never take a weekend course in yoga and go into a setting and teach yoga, like in a clinical setting, just because I got my certificate. And partly because I think, just because I do have a depth of practice, I feel like I could talk about longevity of practice and consistency. I feel I've kind of earned that a little bit. I think if you take a short course, a certification course, and you go into a clinical setting, because this is what Western, administrations need, right? They need this. They need you to say that you have that piece of paper and have that training, is you can't adapt. You don't have the depth to be able to make adaptations for individuals. It's very cookie cutter. There's no room for people that are in that class that need you to do it a little differently, to adapt to what they're doing. And I think at its worst, that could be dangerous, right? Because you're saying, somebody who doesn't have a depth of their own practice from a modality, whether it be Tai Chi or Qigong or yoga or any of these arts, or even meditation, that if you're not able to make that adaptation based on your own experience of practice and see the levels that people need to go through, you may have them doing something that's really can be harmful to the person at its worst. And at the same time, the other side of the coin is, it's great. People are moving, they're breathing, they're paying attention. I think as long as it's done safely, if people are moving, breathing, paying attention, and as long as the instructor is honest with themselves on their own limited experience, then I think that it can be a very good thing to bring it in. I think it's a great thing, actually. The instructor, they got to check the ego at the door, and really say, this is my limited knowledge here, and I will show you what I can, but I don't know. There's a lot more I don't know than I do know about this art. Even if they don't say that verbally, just at least to be honest with themselves. And I think of the tasks within nursing. If there's a particular task that I was not, say, like putting in a urinary catheter, right, is a task that nurses do. If I wasn't really trained in that and I just watched a YouTube video on that and just went and did it and really pretended like I knew, and it's not actually that difficult of a task, but it's just an example of, it's really not appropriate. If I went into it thinking I'm an expert at this, or like I've put in ports on people for when they have to, it's a needle that goes in, and then we can draw blood in it or give medicine through it. And if I wasn't really know what I'm doing, it could be very harmful for that person. So we don't want to pretend we know something we don't know. And you wouldn't expect a surgeon to do that, to just pretend, oh yeah, I saw a YouTube video on this, or I took a quick course in this. You're not going to let them do surgery on you from that, right? And so that's the extreme kind of Western. So I don't see it any different with these type of arts, because if you use that word respect, it's the idea that these arts can be very powerful, and we have to treat them with respect. Now, at the beginning, you have to do, whether you're a practitioner for yourself or teaching it to somebody, when somebody's at the beginning, they have to do a whole lot to get a little bit of benefit. But as they get further along, you do little thing and it has a very big impact, both positively and negatively. So at the beginning, the chances of harm are less, I think, because, they're just moving and breathing. They're not going deep into the practices to begin with anyway. So they're doing a whole lot and getting minimal benefit, I think, at the beginning anyway. But I think as far as the people teaching it, I think the most important piece there is that people have to be honest with themselves at their level of ability. And sometimes that's not the case. As we know, people, they take a week course in something And all of a sudden they start advertising, that I can do these practices, and they haven't done the practice themselves. They haven't looked inward yet. So they don't know all the pitfalls. You're a longtime practitioner, and there's many pitfalls that show up along the way. And if you haven't been through some of those, you can't really instruct somebody well. So that's my feeling on it. And even to this day, you get a little bit of imposter syndrome. You think, well, because I know people that are just their skill level is so incredibly higher than I always can maybe ever wish to be. And I think, okay, I'm out here teaching this stuff, but I really understand it well. So that motivates me to keep practicing and understanding what I'm doing.
So if we were to be switching the perspective a little bit from that of instead of the clinician making sure they're within their scope, how does somebody who is a consumer of healthcare, which hopefully is all of us, who is looking for alternative therapies and they're not necessarily getting it from their holistic nurse, but they're stepping outside of that, do you have any tips for them in finding someone who's going to be a safe and good match for them?
Wow, that's a great question. It's a challenging thing, right? Because it's a challenge for sure. I'd say talk to friends first, right? Look at friends who have gotten benefit from the modality they chose, and see somebody, you look to your community and say, wow, I know that person was sick or injured, or or their mental health wasn't right, or whatever the case may be, and they started doing this modality with this person, with this teacher, or this practitioner of alternative medicine, say like acupuncture or whatever, massage, and wow, they got really improvement with that. They're looking great. I'd say that would probably be the first place to start. And the other place is, I think trusting that inner voice. You have the intention of, this is what I'm looking for. I know there's something out there for me, and I want to improve my well-being. I just want to feel better. I want to be more vital, whatever the case may be, and sit with that intention that this is what I want. And then Google it. Seriously, just Google it. Or look in we don't have local newspapers anymore. Like whatever. Look for somebody who is close by that teaches a class or does massage or is a practitioner, and try it. But let that inner voice guide you, like, that sounds really good. And then try it out. And it may or may not be. And even if it's not the perfect match, it gets you started. Right? So you have to start somewhere. So generally, I say start where it's convenient, where you'll actually do it. Don't set up barriers to yourself. I see this guy teaching, but he's 3 hours away. I mean, I used to travel that much to one of my teachers, but people are not going to do that, right? Oh, I'll change my whole life right now to start doing this. That's not realistic. So starting with the idea of listening to that. So I guess I would say, listen to your inner voice, have the intention first. I'm looking for something to bring me back to equilibrium. And look at your friends, look at your community, see who is getting improvement through that, whatever modality. Try it. And then lastly, find what's convenient to start with, because then you can expand out as you develop in whatever practice it is. I think that would be my kind of take on that.
Well, that's a great note to go out on. Thank you so much for taking the time to talk with me today and educating us on this.
You're welcome.
You've been listening to Resilience Radio. We've been talking about integrative healthcare, I think, in general, and how to integrate that practice. If you want to hear more about this, stay tuned for next week when we'll be talking a little bit more with Rich about martial arts and Qigong and Tai Chi and how they interplay, and get his perspective on that. The music is brought to you by Aaron Marcus with their tune Some Biological Process. Until next time, Take care.